السلام عليكم ورحمة الله وبركاته. أنا منال الدباغ، وأهلا وسهلا في بودكاست لنبدأ الحوار Start the Conversation. الهدف من البودكاست إنه نبدأ الحوار في مواضيع مختلفة ما أخذت حقها في مساحة الحوار أو ما في أحد يبغى يتكلم فيها. المواضيع مختلفة لكن كلها بتدور حول كيف نقدر نعيش بكليتنا مش كأجزاء متفرقة في تناغم مع الناس حواليننا والبيئة. الفضول والشغف هو اللي خلاني أبدأ البودكاست، وهو اللي يدفعني لاختيار المواضيع وضيوف البودكاست. مرة تانية أهلا وسهلا، وإن شاء الله تلاقوا شيء مفيد في الحلقة. وإذا في أي مواضيع تحبوا تسمعوها أو أشخاص تحبوا تسمعوا منهم، أتواصلوا معايا. حلقة اليوم باللغة الإنجليزية. ضيفتي دكتور جيمي ماريتش، أخصائية علاج نفسي مختصة بالصدمات، وكاتبة عندها عدة كتب عن التشافي من الصدمات والEMDR، مطورة Dancing Mindfulness، أسلوب رقص معتمد على Mindfulness والحضور. كمان ساعدت في تطوير يوغا Unchained، اتجاه في اليوغا معتمد على كيف يكون عندنا علم بالصدمات. موضوع حلقة اليوم عن كيف نقدر نكون كأشخاص بنتعامل مع أشخاص تانيين، سواء كنا مدربين يوغا، مدربين رياضة، مدربين رقص، حتى معلمين، بنتعامل مع أشخاص تانيين. كيف نقدر يكون عندنا علم بالصدمات، كيف نقدر نشوف أو ننتبه إذا الشخص اللي قدامنا اللي جاي الكلاس عندنا أو بنتعامل معاهم بطريقة فردية عندهم آثار للصدمات، كيف نقدر نتعامل معاها، كيف نقدر نقول لهم يراجعوا أو يستشيروا أحد مختص أكثر مننا، وكيف نقدر نوفر بيئة قدر الإمكان آمنة لأي شخص بيجينا وبيكون عنده آثار صدمات أو مشاكل نفسية ناتجة عن الصدمات. الموضوع جدا مهم، خاصة لأي أحد بيعطي يوغا، بيدرب أشخاص في مكان بيتحركوا فيه. إذا في أي أسئلة بالعربي، إذا في أي أسئلة لدكتور جيمي، ممكن تتواصلوا معايا، ممكن تتواصلوا معاها. أتمنى الفكرة توصل لأكبر عدد، لأنه جدا مهم إنه إحنا نكون عندنا علم وعندنا دراية بالصدمات التراما، علشان نقدر نكون فعالين أكتر، وعلشان الناس اللي جايين يبوا يستفيدوا يقدروا فعلا يستفيدوا، مش نزيد وضعهم لأسوأ لأنه إحنا ما نعرف كيف نتعامل مع هذه الأشياء. شكرا. Hello and welcome for another episode of Start the Conversation podcast لنبدأ الحوار. Today I have Dr. Jamie Marich with me. She's a facilitator of transformative experiences, clinical trauma specialist, expressive artist, and writer. She's the founder of the Institute for Creative Mindfulness, the developer of Dancing Mindfulness Practice, and also the co-creator of Yoga Unchained. Welcome, Jamie.
Thank you, Manal. So lovely to be here with you. I know it's been a while since we've seen each other in person, so I'm glad we get to have this conversation today.
Yes. It was a lovely meeting when I got my Czech certification got certified for Dancing Mindfulness, and that's how I came in contact with you and your work. And I remember doing the training. One of the highlights of learning for me was the trauma piece that was involved in facilitation. And that was my first kind of, okay, this is what we need to do and what we should and shouldn't do. And I remember you focusing on the safety contract in the beginning of class, and that being a very important thing. This is what we're talking about today. The topic is trauma and why if for yoga teachers, dance facilitators, anyone who is in contact with other people on a professional level, why the need to be trauma-informed. So we'll start ahead with that. And what's your definition of trauma? Because I know there's so
many definitions of trauma from many different perspectives. I like to keep it simple. The English word trauma, and that's the word that's used in many global languages, derives from Greek, meaning wound. So it's a pretty simple, direct translation. And I think that tells us so much of what we need to know. So when I am asked the question, what is trauma? It's any unhealed wound, physical, emotional, sexual, spiritual, that is still impacting a person's life. And a point I'd like to make to that is it's not the wound itself that is necessarily the problem, because if an individual is given a chance to heal that wound, if they're permitted to heal that injury after it happens, and think of that in physical cases, think of that in emotional cases, that wound can go on to not be a problem. Yet what we tend to see impacting people is when wounds are left to fester and infect and they're left untreated. And that's when they can cause a whole series of problems in an individual's life across the spectrum. So keeping it simple, trauma is any unhealed human wound.
Yeah. And what is trauma-informed? We'll dive deep into it.
That's what I was going to talk about next, but I didn't know if you had any follow-up. So to me, being trauma-informed is obviously having an awareness of at least a couple basic definitions, yet it's also having an awareness of how unhealed trauma affects the human brain, and in turn, how that brain activity plays out in the body and in other areas of functioning. So the reality is when a trauma or traumatic experience remains unhealed, it can still be stored with what we call a really primary center of limbic level activation. And the limbic brain is the middle part of the brain where we often talk about the fight flight response happening. It's the brain that filters information as dangerous or not dangerous. It's the brain that really is the panic button in the human or the mammalian experience. And if a traumatic experience hasn't been given a chance to heal, the memory storage can stay in that limbic activated state. So what that means is it can wreak havoc in the body, so to speak, because so much of what happens in the limbic brain and the brainstem below it is bound to play out in the body in symptoms like freeze. I talked about fight flight, tense shoulders, butterflies in the stomach. And the other important thing to understand is when a memory is triggered, we use that word quite a bit now in trauma work, triggered, when something even similar to an unhealed memory can come up, it can cause that limbic brain to go into a similar state of activation, which cuts us off from the rational learning of the front part of the brain. So what that means is it's unproductive to tell people things like you should know better. Because yes, when my limbic system is not as activated, yes, I may know better. I may know that I'm beautiful, I'm smart enough, and I'm safe enough, and all of this. Yet when any of that activation comes online, essentially blood flow is suspended to that brain that does know better, where we do have wisdom. And so how this translates for providers, whether it's clinicians or yoga teachers or dance teachers or classroom teachers, is that trying to talk reason, trying to talk rationally when somebody is in a state of crisis, which I'm defining as that level of limbic activation, is futile because the rational brain is not online to really receive it. And the other thing to understand about the limbic system and limbic activation is that brain we can't get to easily with just words, because words and verbal development have nothing to do with the limbic brain. The other thing is the rational sense of time, that the limbic brain, I heard a teacher explain it this way once, and I really liked it, has no clock. Oh. So another real kind of foolish thing trauma survivors can be told are things like, well, it happened 30 years ago. It happened 20 years ago. Why aren't you over it? And the reality is, in my rational brain, yes, I may have that understanding that it happened in the past and I'm safe now. But if things are still stored with that limbic activation, at least on some level, you may feel like that same torture and torment is happening now. And another big facet of being trauma informed is understanding that the key to healing trauma really does go through the body. It goes through building awareness of breath and body sensation and learning how to befriend the body. Yet that can be very difficult when so many survivors of trauma have received just very unkind messages about their body, or have felt like their bodies have let them down, or their bodies don't look a certain way. A lot of folks who grow up with religiously charged messaging can have certain beliefs about their body that can keep us cut off from accessing what we may need. So that's kind of the nuts and bolts of what I think it means to be trauma informed, is to have that basic understanding of trauma in the brain, and to recognize that this understanding is not about giving people excuses, but I'm sure we'll talk more in this conversation about how we can work with that reality to adapt a lot of the practices we teach to make them more accessible for people, really all people, but especially trauma survivors, and how hopefully those practices that may once have felt activating or threatening on some level can be used to usher in your highest good and healing.
Well, you mentioned memory triggers, and from what I understand, it could be just anything. And that kind of link the person consciously or unconsciously, most of the time it could happen unconsciously, of something that happened way in early childhood where there's no kind of a logical, as you mentioned, reason. So it could be like a color or a smell or something.
Very much. And there's a proverb that trauma scholars and trauma teachers often use to explain the phenomenon. It's a Chinese proverb which states that once you've been bitten by a snake, you're afraid even of a piece of rope. So consider that. I'll say it one more time. Once you've been bitten by a snake, you're afraid even of a piece of rope. So even if it's not the exact same thing happening to you, anything that feels similar at the level of the body.
Yeah.
If you smell a scent that was there at the time of the trauma, even though it's a totally different context, it can set off that same type of phenomenon. And what a real good comprehensive course of trauma recovery will hopefully help a person to recognize and shift is that the rope is just a rope.
There's a similar kind of a proverb in Arabic, which is...
Oh, yeah?
Yeah, I'll say it in Arabic, then I'll explain it. It's اللي يتلدع من الشوربة ينفخ في الزبادي, which is if you get kind of burnt, you burn your tongue drinking soup, you kind of gonna blow on yogurt.
Ah, yeah. Yep.
So it's kind of the same kind of concept of, even though that it doesn't make sense that you're gonna blow on yogurt, but you still do that based on...
Makes perfect sense to me.
Yes, exactly. So you mentioned different types of trauma, and you mentioned spiritual trauma, and you mentioned, how the, some religious practices can affect how we relate to the body. And that brings me to a question of trauma could be anything. It's not just the horrible sexual abuse or physical abuse or the natural disaster. Is that correct?
Yes. And that's really what the field has increasingly understood in the last 20, 30 years, that the early conceptualization of what was called the post-traumatic stress disorder diagnosis did focus on the types of traumas that you mentioned. But the more and more we've learned, we've discovered that other life situations that are wounding, that maybe previously did not have the connotation as being overtly traumatic, can still impact the brain in a similar way. And speaking to the phenomenon I talked about earlier about unhealed wound really being the variable, that a person could go through something like a natural disaster. And if they have the kind of natural capacity to cope with it, whether it's inherent or learned, because they learned the coping skills, maybe they've received the adequate community support after a natural disaster, they can heal and go on to be okay. And that's really the same for any type of the traumas that you mentioned, that it's really not the nature of the trauma itself. More so, was a person given the time and space and resources if needed to heal with it afterwards? Because we've seen kids who are bullied in school and we're told things like, just toughen up. Teachers, parents might pretend it doesn't happen. And the message learned as a result of that bullying stays stuck in that limbic activation. the healing's never able to happen. And that thing of bullying can go on to be a worse issue for somebody down the road than, let's say, somebody who was able to accommodate and heal a natural disaster. So I really don't think it's helpful looking at like the nature of the trauma as much as how did it affect the person. Because I've seen traumas of wounds, if we're keeping it simple, of all different varieties affect people in different ways.
So it's not necessarily about the event. So going back with the route of, talking about the event, is that useful alone if someone is traumatized?
It's a good question. I never want to impugn or belittle if that works for somebody to go back and have more of a narrative telling of the event, that for some people that does it. But what trauma-focused therapists are generally seeing now is that just being able to recount what happened in a narrative fashion without connecting to the emotional and body experience that is still stored, it's generally not going to be enough. Because we've seen time and time again cases of people who are able to tell you everything that happened, and it doesn't necessarily seem to bother them anymore, or they can give you a lot of detail about what happened, but they haven't healed from the impact of it. And that's generally a sign for me that they haven't let themselves feel what got stuck at the time. And people ask me a lot, especially when they come into me for therapy, do I have to recount everything that happened to me? And my short answer is absolutely not. When people will say, do I have to relive what happened to me? Definitely not. But what I would challenge you to do is, will you let yourself feel what you haven't been letting yourself feel for so many years around it? And that could be scary too, to be clear. But this is also where the movement practices that I know you and I love so much, a lot of the other expressive arts practices can hopefully give people a gentler path into feeling what they have been stuffing or burying connected to the experience.
So it goes back to the body. We need to start with the body and go there. And that's what I do with my coaching now. And I do embodied coaching and I find that people kind of seem surprised and relieved sometimes in that I tell them I don't need to know the story. And I'm not a therapist, so I'm very, very clear that I'm not going to go there. And I tell them all I need to know is how are you feeling right now, and what is coming up for you right now in terms of sensations. Even if they're just kind of playing with what's bothering them, what's stressing them in their head, but I still also keep that line of let's not work on the big stuff because I'm not qualified to do that. And that brings me to the being trauma-informed as non-therapists, non-clinicians, of what are the signs, why, and that's one of the reasons why I think it's important to be trauma-informed as a practitioner and facilitator of dance or whatever. What are the signs that tell me, oh, okay, this person needs more of what I can possibly offer, or just know the signs of this person is heading into kind of a traumatic response where I need to kind of say, I need to be concerned of their safety and know what to do.
Sure. Even before I answer the question, there's just a couple things you said I want to highlight. That, first of all, being trauma-informed is for anybody who works with the public. That, yes, clinicians or psychotherapists or psychologists might be the ones who are officially licensed to do the deep work with it, but dance teachers, movement teachers, classroom teachers, you are often the ones seeing the first signs of it, who can at least act in a way that does no further harm if an individual is kind of getting triggered or tripped up. But even in a lot of your work, what you talked about, having people notice sensation without attaching a story to it. I mean, that's a brilliant example of trauma-informed work. As long as you have adequate understanding or feedback from the person that what you're asking them to experience sensation-wise is something that is in what we call their affective window of tolerance, that they're able to use breath and grounding to hang out with it and not be overwhelmed or flooded. And I think a key thing is to have a stop sign established, especially when you're doing one-on-one work with someone, that if we've gotten into an area where you feel you're kind of outside the zone of tolerance, let me know. In group settings, a big precaution I teach is letting people know that like opting out is always an option. That's something we say in Dancing Mindfulness, that if the energy of the group moving together is getting a little bit outside of that window, you have a right to sit out. You have a right to step out of the room. You have a right to like do art or other coloring or writing that might be available in the room. That having a break is a very important part of what may be required. I mean, signs and symptoms of it can show up differently for different people in classroom type settings with dance and movement. Some people, if you notice, they're always avoiding the same thing at the same section of a class, that could be a sign. Because avoidance, I always say in the English language, it's no coincidence to me that dance is in the word avoidance. Because think about it. Because whenever we go further, let's say with an emotional piece of dance or invitation to movement, if the person's like opting out constantly at that section of the class, it's fine. They have the right to opt out, but it might be something you address with them one-on-one to ask, just this is what I've noticed. So you're not accusing them, but this is what I've noticed. Is there anything I can do to be helpful or supportive here? Another big sign of that a person's getting affected by trauma that we often talk about, like, the acting out, like somebody having a big startle response or being hypervigilant, or maybe like, just screaming out if something bothers them. But I don't think we see that nearly as often as the other side of it, which is to go into more of a dissociative shutdown response. So if you notice that a person is like not making eye contact with you, especially at the end. And I realize there may be some cultural variance there, because in some cultural interchanges, direct eye contact may not be appropriate. But I say, for instance, in dancing mindfulness classes, when you're doing the check-in with the group at the end of the session and somebody's not making eye contact with you, it's probably a good sign to go up to see if there's kind of back there with you, present in the room. Because a lot of times the flood of emotion or sensation can cause a person to go more into that zone out, check out, shut down that we identify with dissociation. And another good common sense thing is I generally, and I hope the yoga teachers listening to this find this helpful too, direct touch is typically not helpful. So if you are practicing in a style of yoga where you do physical adjustments, you want to make sure you give people some kind of opportunity to opt out of those if they don't want to be touched. And I know, at least in the America I grew up in, there tends to be this sense of, when a person cries, because tearfulness is not a bad thing. I mean, if a person's flooded and outside their affective window, we may need to help them ground for sure, or to come back into that zone where they can tolerate. But I think, I grew up in a world where over crying was seen as like, don't let people cry. And so like we give them tissues, we hug them. And something I learned in my own kind of advanced yoga training journey here is I actually don't like being hugged when I'm crying. I almost feel like it's smothering. Somebody's trying to, like, I'll take the hug afterwards, but when I'm actually crying, I need that sense of space and not feeling like I need to be hugged or touched. So, I mean, I could go on, but those are just some of the basics that, I would hope to cover for people listening. And I hope that's helpful for them.
Yeah. Well, you touched on a big thing for me, is the touch. The adjustments, and in your training and in other trainings that I've done in the past few years is, the importance of consent and the ethics of asking and letting someone know. And I really know that most yoga teachers, I haven't encountered personally someone who their intentions are not good, but normally there's a good intention of, okay, could be helpful. But the fact is that it's not always is helpful. And with the conditioning that, at least in our culture and so many cultures, that saying, opting out, or like saying, no, I don't want to be touched, can seem rude and, kind of unwelcoming. But I personally have grown into, please don't touch me. And once I was in a child's pose and, the teacher came kind of, it feels nice to be kind of pressed in the back, but because I did not see it coming, that kind of ruined my experience. And I remember you had an article, and I
was just thinking of that. Yes,
and and a really, I would say, comedic, funny video that you were kind of.
So, yes, on my resources site, the video about all the ways yoga teachers cross a line.
I'll put a link to that in the episode notes. But in the spirit of wanting people to have something to actually do, not telling them you're doing everything wrong. Back to that article, and I have shared that article with so many people, especially yoga teachers, because I think it's really important to, set the space. And many yoga teachers, meditation teachers, they talk about safe space. And I don't know how much of understanding what a safe space is they're doing. It's not just saying it's a safe space. Of course, we can't know exactly, everyone who's stepping into class, and they might not even know that they have trauma, but how do we set the space in a way that be trauma informed?
Yeah. And that speaks to another, we say in English, soapbox point of mine that I go on and on about whenever I have an audience to do it, is that setting safe space, it's a beautiful intention. I'd like you to think of it more in terms of how can I keep the space as safe as possible for most people? Because no space is going to be 100% safe for 100% of your people all the time. Because I know as a multi-trauma survivor myself, safety is not an all or nothing thing. Every situation I go into, I'm trying to negotiate, do I feel safe enough with this person to give it a chance? Because if you as a survivor are expecting to feel 100% safe before you try something like yoga or dance, it may never come just because of the nature of safety as being something that can exist on a continuum. And the world we live in is just not a safe place, if we're being frank about it. So I encourage teachers to set this intention of what are some small measures I can do to keep the space and the practice safe enough. And a lot of what we covered already are measures you can do. Please, please, please do not tell people you're in a safe place as a way to do that, or you're safe here. Because what you are doing when you say that statement is you're telling somebody what to feel. And that is fundamentally not trauma informed, because a person may still try to be negotiating. Do I feel safe with this person? Do I feel safe here? And then if you come in and tell them what to feel, that can fundamentally be very invalidating. So, as a teacher, I've said things like, I'd like to try to make this space as safe as possible for the group. So here's some guidelines that we'll endeavor to practice. But anytime you talk in language that tells people what they should be feeling, is fundamentally not validating and not safe, not trauma informed. Because the article you referenced, I even have a big passage in there that it grates me when I hear yoga teachers or dance teachers say things like, well, this movement alleviates back pain. Because you may be dealing with people who have serious back injuries. And yes, that pose or that movement may be known. So even listen to the language change up, at least in English. Like, it may be known to alleviate back pain. It could be helpful to the back, but don't speak in absolutes. Even when it comes to this pose feels wonderful. Because I know, as from the yoga perspective, downward dog is still a challenge pose for me. And it really grates me when teachers talk about, oh, it's a resting pose and it's a wonderful stretch. When they gush on and on about their favorite pose. And I'm just as guilty. I could do it with child's pose because I love child's pose. I think it's an awesomely beautiful stretch, but I'm aware that there are people out there who find it claustrophobic and it's challenging. So I think part of the recognition is that every pose can be its own challenge for different people.
Yep.
And so even bringing some of that awareness into your language and facilitation, and then just not speaking in absolute terms, is a really good way to create safe space. And I even did it over the weekend. I was teaching a yoga class and I said, this is one of my favorite poses. I don't know how you'll feel about it, is one of my favorites. So if I want to give that punctuation about how helpful a pose can be, I'll keep it on me, but let people explore it for themselves.
Yeah, one of the things that gets me if I'm in class is when the teacher says, I'm sure you'll feel wonderful, or something on that terms. Oh, you're going to finish the class and it's going to be the best thing. And in my head, it's like, how could you be sure that this is going to be a wonderful experience? Because, I might be bored. I might just, be too hot or have a headache and not end up having a great experience.
Avoid telling people what to feel. Avoid telling people what they need. Yeah. It's just a great trauma-informed strategy.
I learned this the hard way, where I was teaching an embodied yoga principle workshop, and last one is self-care, which is a self-hug. And I love that. And I could stay in that posture for some time. And it's just so joyful and uplifting. And I've kind of made the mistake of having that I was thinking it was a cherry on top at the end of the class. And one of the participants had a major kind of overwhelm with that. And I still feel bad about it right now, is that she had to rush, because I made that kind of the end of the class and she had to leave, and I didn't have the chance to witness that or kind of help her a little bit to get out of that overwhelm. And since that day, I was like, I'm not going to assume that a posture or a song or something would have the same effect, and it would be amazing for other people as it is.
And what you just said right there is key, that to be a trauma-informed facilitator, learn from your mistakes, because you will make them.
Yeah.
And I always remember one of the biggest learning experiences I had this was years ago, probably almost 15 years ago now, in my therapy practice. I had just been trained in EMDR. I had just learned, some kind of guided imagery technique that we do in EMDR. And it was so automatic for me to say to my client, close your eyes, because that's how they taught us. And so many imageries I had received were closing the eyes. And we were going into this exercise, and the client, about a minute or two in, just screamed. And Bolter goes, no, I don't want to do this anymore. And so we took a breath. I asked her to help me understand what happened. And she said, my eyes were closed. She said, when I was abused, it was in the dark. And I was getting relaxed in this meditation we were doing. And when I got abused, my abuser would say things like, relax. And it was the dark. Oh, wow. And that's this whole potentially helpful exercise triggered that for her in a way that she wasn't prepared to deal with it. And that client never came back. And I hope I have paid it forward from that experience, because I've learned it was such a valuable learning experience for me. Do not force people to close their eyes at all. And in a lot of traditions of yoga and dance and meditation, there could be that automatic close the eyes because it helps you drop in or go deeper within. Always give people the option, because even that something like that is a real simple. Maybe explore between the two. Do which one feels safer for you, but also helps you feel more present. And the reality is, in a lot of traditions of meditation, eyes are suggested to be open because it still helps you stay more connected to the presence of the room and the here and now of where you're at. So I heard this said once that the definition of an expert is somebody who's made every mistake possible.
Okay.
And yes, that's me.
Yeah.
And the key is, when you make mistakes, are you willing to learn and adjust for next time? And my whole career, and why I think I could still speak with authority on this, is because I've had to do a lot of that learning as I've gone and taken feedback from people. And I'm still learning. None of us are ever done.
Yeah. It's a path that doesn't kind of end in an exploration of body and self, right, that keeps unfolding. But one key thing you kind of brushed on is how, what it seems like simple things as close your eyes or not, or at least not giving the option of keeping the eyes open, and small things that are in the surrounding could stop someone from coming back to something that could potentially help them. So because, yoga, there's a lot of, it could be healing. It could be a great modality for, self-care and, all that stuff, but with simple, mistakes or that could stop them from ever going to a yoga class again.
Mm-hmm.
So giving the option is not only good for the person, it's good for everyone, that it keeps the door. And I think as humans, we always want to have the choice. So if you tell me, there's always this joke with kids, you're going to have fun. It's like,
yeah. Don't tell me what to feel. Going back to that earlier point.
Yeah, exactly. Right. Now, also another thing that you mentioned is keeping the eyes open can help ground. And from what little I know about trauma and the nervous system, kind of orienting to our surrounding helps us kind of get over the overwhelm, or at least, feel more grounded. Can you speak a little bit more about that?
So the definition of grounding that I use in my work, and it's based on some others' definitions, but this is kind of my own presentation and twist on it, is using all available experiences, all available senses to come back into the here and now. Because fundamentally, that's what grounding is. And being oriented to space is probably the most physically tangible way you're able to access here and now, which is why I think before you get into anything potentially more esoteric, and that could even be the breath or dance or movement, to make sure that people have a basic grounding sense. And that could be pick one object in the room that you can look at any time and know without a doubt that I'm here and now in Jamie's studio right now. Mm-hmm. And this interesting kind of take on it came up in the literature last year, which I think is interesting, is that fundamentally what we're talking about is mindfulness, and it's a mindfulness strategy, being able to ground, really is the opposite of dissociation. And dissociation is this phenomenon in the brain caused by trauma that causes us to sever from the present moment, when the present moment is unpleasant or intolerable. And I mean, we all do it. It's a natural part of the human experience to check out here and there if we're feeling overwhelmed. And obviously people who have more advanced issues with dissociation can have a whole, slew of other problems. But the reality is when we're inviting people back into this place of mindfulness and grounding, what we're saying is, come back, so to speak, to the moment. I know there's neuroscience to support this, and that's not my strongest suit on this as much as it is kind of the fundamentals of teaching it, which is that when I'm defining mindfulness, it is that process of coming back into the here and now, which suggests for me that you're coming back into awareness, that your attention drifted. And that's normal, especially in our culture today. We're always being pulled in a million directions. But I encourage people to be kind with themselves, because even your awareness that your attention wandered, something told you that too, that, wait, I'm not aware anymore. So even that is practicing, being able to come back to this nowness, to this. There's an author I like named Michael Gungor. He's actually it's a funny story, because he's a Christian musician who ended up like abandoning all his faith in God. And then he had an experience with Ram Dass and came back to kind of God understanding, God consciousness through more of the Eastern path. And he wrote a book very recently called This. And it was an interesting title because he said, peace is found in this moment, this time, this place. And what tends to cause the distress is when we're in that. We want to be in that place. We want that to be different. I want it that way. Quoting the Backstreet Boys. And that's so much of what peace is about, is learning to live in the this. And that's why I practice mindfulness. So
that's a beautiful kind of a reminder. It's like, it's this, not that. Well, to go back to the making the space as safe as possible, or say in that sense, we brushed on, adjustment or touching without kind of consent, and giving people the option of saying, I don't want to be touched, and the kind of closing the eyes, giving the option again of keeping the eyes open, because these things really happen in most yoga classes. What other things that, as a facilitator, I need to, and those listeners could watch out for in that space?
I really think we've covered a lot of the basics, to be honest. In terms of things to watch out for, I mean, you're going to get a whole different slew of reactions from people that might indicate something's wrong. And so I think the key is not ever drawing direct attention to one person, like if they're crying or if they're shutting down. I mean, sometimes in a yoga or a dance class, it could be appropriate just as you're wandering the room to walk up to that person, maybe take a breath next to them, make eye contact if they're willing, not touching them, but just to let them know that you're there and aware without drawing too much attention to it. And sometimes that was sometimes called like ministry of presence can be a key. And then if they're not making eye contact with you or they're not showing that they're grounded at the end of an experience, you may want to go up and check in with them. I mean, I also think a big thing is, especially in class settings, making yourself available after class is a good thing. And I always tell people I train, it doesn't have to be for a full-on therapy session, especially if you're not a therapist. But often I like to issue I'll be available for 10 minutes or so after class if somebody needs to check in about anything. And at that point, if a person has an unraveling or a not so great experience in class, we can maybe come up with a plan. Like, what is it that bothered you? How could you address it differently next time? Maybe it's even a matter of going to a different style of yoga class, opting out of that pose. Or maybe if they are involved with a therapist or a wellness coach of some kind, to say, hey, why don't you follow up with that person about what you experienced in the class? Because this might be good material for you to bring into your work.
A question kind of popped up, because especially maybe not in a yoga setting, but in a free dance setting, is that idea of catharsis being, a good thing. And it could be a good thing in some ways, but that kind of, I don't want to say push, but that kind of where it's not ethical or not a good idea for dance facilitator to kind of push that individuals to that catharsis that can unravel so many things.
So much of the answer is even how you said the word push 2 times. And I think that's key, that when we push people into that, and sometimes dance facilitators can promote some of that almost peer pressure, like, come on, let's do this work, let it go, leave it here. And this might be a good place to kind of wrap up, because it's a good trauma-informed ethic, whether you're teaching yoga or dance or doing therapy, which is language of invitation instead of language of choice. Because we talked about choice here a little while ago. That fundamentally, what empowerment is about is giving people the right to choose. And I know I was doing a letting go type of dance over the weekend in a dancing mindfulness workshop. And even though the invitation of the dance was to let go, to send down to the ground, whatever it is you wanted to release, I told people, let go of what you're willing to let go of today. And so you can still create an ethic of, yes, like promoting something or advocating for something, but not forcing or pushing is absolutely key. And that is something that as a facilitator or teacher, you have to do your own work and check in about. And to ask if it feels like I am getting pushy with some of my language. Is that more about me wanting it for them? Is it more about me being successful in doing this? Like, what is that about? Because fundamentally, people respond best when they're invited. They could be challenged, for sure. Because I think letting people opt out of everything, it's okay. And like I mentioned earlier, if a person opts out at the same time, every experience, you may want to check in with them about it. So a person can definitely be challenged, but it's usually best done when it's in the context of invitation and when it's not forced. Language of invitation.
Yeah, we're coming to the end of the hour, and you mentioned that we're always learning, and learning that doesn't stop. So I'll ask you, what's your learning kind of edge? What are you finding yourself curious and fascinated about?
Yeah. So actually, right now, as we record this, in the next week or so, I'll be going down to finish the last 100 hours of my 500-hour teacher training, because I've had a lot of trauma-informed yoga teacher training over the years. I've done the basic yoga training, and I've enhanced my learning with doing more yoga nidra and a style of yoga called meditation in motion, which is well known in the Kripalu and Amrit system, that I've been very passionate about exploring deeper, because it's really helping me learn more about the energetics of yoga. So so much of my thing is to always be learning something new every year, whatever that is. And so I've taken trainings even in things that are not necessarily therapeutic trainings, like deepening the yoga training. Years before dancing mindfulness, it was deepening my dance training. A few years ago was learning aerial yoga, learning jujitsu. That any way I can explore new facets and new areas of my body, I'm down for it.
And on the kind of scientific clinician side, is there anything new that it's coming up?
Deepening my yoga practice is helping me be a better clinician. It's really what I feel. I mean, I'm continuing to do some writing and research, obviously, in the EMDR area. We're actually working on a research study right now about therapeutic use of jujitsu as a trauma and the martial art as a trauma mechanism. So I still have my toe in that academic world with it yet. I mean, for me, being a good trauma-focused therapist is fundamentally about having explored your own wilderness. And these last few years have given me ample opportunity to do that with both my yoga practice, my yoga training, and continuing to deepen my own work as an EMDR patient too.
Yeah, that's the reason kind of I was poking and asking, because I know you're an academic and you're doing research. So where can we find more about you for the listeners? And you can talk a bit about your trainings that you do. Yeah.
So the easiest place to go for resources, and it's an easy website, hopefully, is traumaMadeSimple.com. So it's www.traumaMadeSimple.com. And there you can get the videos that Manal talked about, the Yoga Unchained videos, a lot of trauma-informed mindfulness videos, all the articles that I've done that are available online. You can get on that website. If you're interested in dancing mindfulness, dancingmindfulness.com specifically is the easiest place to go for that. And then my business, Institute for Creative Mindfulness, you can click there if you want to learn more about the specific trainings that we do. So the Expressive Arts program, which Yoga for Clinicians is now part of that. And but really between those three websites, you'll be able to get good access. And then they all link back to my personal website, JamieMarich.com, which has my calendar of where I'll be in the world.
Yeah. And if anyone is interested in dancing mindfulness, come and join a class with me. And maybe we can get you here for a training.
I would love to. Manal was our first facilitator in the Middle East. So it was a pleasure for me to train Manal remote.
I'll say, I said at the beginning of the episode, I'll say it again. I've learned so much from that training. My, beginning of being trauma informed was with that training. And I've learned to keep colors, paper, kind of mandalas, printouts, and put it to the side of the room and give people the option of at any point you want to go sit in color or do anything and do any writing, feel free to do that. And I think giving them something that they could do, kind of more encouraging for them to opt out or sit out instead of just sitting in the corner and doing nothing, and they might feel kind of self-conscious. So that was a great thing that I've taken not just into dancing mindfulness, but for all my other workshops.